Hello, welcome to the Atlantic Current. I'm Tull from the Irish Politics newsletter, and as always with Vince Martin from Wall Street and Maine. And we're going to be talking about healthcare in the United States and Ireland and Europe in general. Vince, researching this, I got the impression Ireland has a health service, America has a health industry. In Ireland, the state taxes you, puts you in a queue, kind of mildly irritates you on some level, I suppose, and then more or less looks after you in the best way it can. In the United States, everybody smiles, hands you an iPad maybe, calls you sir, and then sends you a bill, the equivalent of a GDP of a small African country. Is my read on that correct, Vince, or is it just hyperbole from Tull again?
I think it's a little bit of both. I love that phrasing of it being a health service on one side of the Atlantic and a health industry on the other. And that's definitely not completely inaccurate. The largest health insurer in America, United Healthcare, has a market capitalization over $300 billion. And that's one tiny part of this massive industry. So I think that part of it's very true. The details, I think, get a little more complicated, but also a little bit more interesting. As you said, that the medical provider gives you a bill with the GDP of a small African nation, and the bill may very well be that big, but it doesn't always go to you. That bill gets presented to someone. Who that is depends on who you are and who they are.
Yeah, look, it'd be unfair to say that Ireland is not without its own health industry also, now that I think about it, considering I had a look at my breakdown of my health insurance recently, and my eyes were popping out of my head also.
Yeah.
What's the most surprising thing for you when you were researching this subject?
I didn't realize how much variability there was in Europe. In particular.
27 different countries, 27, largely 27 different healthcare systems.
Right. My assumption was that most, if not all of those countries were single payer, because that is pretty much the alternative that we have here during our debates that people talk about. It's either this system or single payer. And that's actually pro and con. People on the left who want universal health care are usually looking at the single payer model because we know that model from Britain and from Canada. I know Canada's not part of Europe, but
some would claim Britain is anymore, But Canada is still part of the Commonwealth. So the 27 countries, 27 different healthcare systems.
For American listeners who don't have that knowledge, as I did, Germany, for instance, is a multi-payer system with taxes on employers. France is tax-funded, but it's public-private. They're far, far different than I realized.
And European systems are tightly regulated also. So you have what's known as the beverage model, I think, is the French one, and the Bismarck model is the German one, I think, where the state controls the prices, the benefits, and the planning around everything, as opposed to the private health insurer, doing all that kind of work.
What did you find to be the biggest surprise looking at our system?
This came as a real surprise to me to learn that the USA has, out of the OECD countries, modern economies and all that kind of crack, that the US is near the bottom on life expectancy despite very high health spending, and Ireland's somewhere near the top 6 or 7, but the USA is quite low. Costa Rica has a higher life expectancy rate than the United States does. Finland does, Estonia does, Croatia does, Poland does. The United States is somewhere with the Slovakian Republic, China and Colombia. They're all in the same bracket, and that was a real surprise to me. And Ireland is above the EU average and above the OECD average. And if you pick up a newspaper here in Ireland or switch on the internet, the media maybe kind of would have you believe that we're a third world country when it comes to healthcare systems and healthcare outcomes, when in fact we're actually quite near the top.
Well, it's the Guinness, right? I mean, I've seen all the advertisements.
Yeah, it's all that iron in the Guinness that keeps us healthy,
My sense was that the international perception of U.S. healthcare is not particularly positive. So were you surprised that our overall outcomes are disappointing, whereas the international perception is more that our outcomes at the bottom are bad?
Yeah, I was really surprised that, because in Europe, core services are funded from general taxation, okay?
Right.
Your MRIs, your CT scans, your cancer treatments, they're paid from the general taxation and delivered mainly through the health service executive, the HSE. Some people like me have private health insurance, and we kind of use that to bypass the queues in the public system. So my surprise there was that if you break your arm in the United States, like a friend of mine did recently, he was hit with a bill for $32,000 because he
Right.
broke his arm. Now, if I break my arm and the doctors want 32,000 euros from me, I want a new arm. I just don't want to fix the arm I have. I want a new arm, like, your man out of $6 million man. Remember that program? I want a new arm. I want a fully functioning new arm that can, lift 200 kgs over my head with one hand. What is going on there that people are paying $32,000 for a broken arm?
We have no idea. No one's really sure. Like the person getting the bill is like, this is nuts. And the person giving the bill is like, yeah, because our system is just so incredibly convoluted, bills are not clear. They're opaque, which is one complaint from the left and the right. You don't know them ahead of time. So to your point, if you fell and hurt your arm, you might go to the emergency room and say, how much is this going to cost? And if they said it's $320 to get an x-ray and get it looked and maybe a cast, you go, okay. And if they said, well, if you broke your arm, it's $32,000, you might just be like, all right, I can use my good arm and hack off a couple limbs in the backyard. I got duct tape in the garage and we'll just wrap it up. And
But when you go in, they just don't tell you, do they?
No, you have no idea. Yeah. So
if I go to a private hospital in Ireland, right, so a private consultant, or if I go to an A&E, they actually tell me up front how much it's going to cost.
You have that for some procedures and with your insurance, but no one really knows what the total cost of that visit's going to be. And then the bills get kind of gamed between if you have insurance and if you don't, and if the government's involved. And when I say that they get gamed, that sounds like, oh, it's just a massive fraud. I don't think that's actually the case. Yeah, or con, or part of it is that's an emergency room bill. The emergency room has to serve anyone who doesn't have insurance. You joked in the last episode that this was going to be like a 35-part series that lasted into 2033. And going down these kind of rabbit holes is exactly how that happened. There's a book by a guy named Ezekiel Emanuel, who's a bioethicist, a very interesting guy. Some listeners may recognize the name. His brother Ram was the chief of staff for Obama and then the mayor of Chicago.
Oh, yeah.
And his other brother, Ari, is a huge player in Hollywood now. He was a super agent. And if anyone saw Entourage, Ari Emanuel is the inspiration for Jeremy Piven's character, Ari Gold, the highly profane, highly volatile agent. But their brother, Ezekiel Emanuel, who seems to be a little more laid back, wrote a book helpfully titled, Which Country Has the World's Best Healthcare? He covers the U.S., of course, along with countries in Europe, Asia, and even Latin America. He gives a very balanced overview, but one of the things that he writes, which struck me as almost certainly true, is that, quote, the American system is an order of magnitude more complex and difficult for patients to navigate than any other healthcare system I've studied. I mean, it's not just a matter of looking in from the outside. It really is that big of a mess.
It's a patchwork of private insurance, employer plans, Medicare, Medicaid. I don't know what they are. Out-of-pocket payments. What are out-of-pocket payments? Is that your health insurance doesn't cover you, is it?
Essentially, right. Yeah. If you're insured, an out-of-pocket payment is basically what you pay. The bill is $1,000. The insurance pays $850, and you have to pay $150.
Right. What's the point to have health insurance there then?
Because you need to. It depends on what kind of plan you have and what kind of deductible you have and what your maximum limit is. We're proving Emmanuel's point in real time.
Okay. What if you can't afford to have cancer care? Another autoimmune disease, take your pick of whatever poison that is killing you. What happens there if you can't afford your cancer care? If you can't afford the oncology?
It depends is kind of the weakest, best way to put it. I mean, one thing that you can do is just basically go into debt. And that does happen to people. People keep doing their treatments. They try and pay for them out of pocket. They can't. They build up, they go into bankruptcy.
Medical debt is the leading cause of personal bankruptcy in the United States.
That is what some people say.
That's what some people say.
Even that is up for debate. If you ask me to pick, I would say it's not quite true, because the short version of it is the people who say that basically say, most bankruptcies include medical debt. And so they say, okay, well then it was a bankruptcy,
So they're putting all the debt together, is it?
Right. I can't pay my mortgage and I can't pay my medical bills. Some people look at that and they go, oh, well, medical debt was a contributor to the bankruptcy, so that counts. And other people go, no, that's kind of silly. The medical debt was $8,000 and the guy was $600,000 in the hole.
I've seen wild figures researching this, ending between up to 66%. They're saying could be linked medical bankruptcy.
Yeah,
66.5% was the figure, and the lower end was somewhere around 40. But even if it was at the lower end around 40, that is a wild number. And almost 50% of everybody that goes bankrupt is because of medical debt.
Bernie Sanders has said during his campaign that the figure is about 500,000 Americans a year going into bankruptcy over medical debt. That number was disputed, but it's a high number.
I'm just wondering, the living in fear all the time in case you get sick must be incredibly stressful. What happens to the people that are uninsured?
If you're uninsured and you go to emergency room, they have to take care of you. They can't ask if you can pay for it. They can't do anything like that. That was part of the rationale of Obamacare, is that when people are uninsured, they wind up getting care through the emergency departments of these hospitals, which is a terrible way to get care. It's bad for them and it's bad for the people paying for it because it's incredibly inefficient. If you're talking about something that's more chronic, things like that, there are free clinics. There are programs that hospitals run, that you can apply for. If you don't apply, there are these.
Charity. Is that what you're saying? Charity.
There is some charity stuff, particularly if you live in a small town, as I have a few times. You'll see, a fundraiser at the local pub for someone to help with their medical bills, or, through the church, things like that. I do think it's overstated that you don't get any care at all, because you probably will have access to some care. But to your point, yeah, it may wipe you out financially. It may ruin your kids if you're older. I mean, there are stories of that where, a mother or father who's in their late 50s hits a rough patch. I don't want to say it's quite as bad as I think some of the worst stereotypes suggest, that if you can't afford insulin next month, you're just dead in 2 weeks. But it's not a situation that anyone wants to be in.
Employers are the main source of health insurance in America, are they? What's the numbers there?
About half of people get their health insurance from employers, 21% from Medicaid, which you mentioned. Medicaid is for low-income Americans.
So who's the underwriter for Medicaid? Is that the government?
Yeah, that's the government.
Right, okay. Simply put,
massive government-funded program alongside Medicare, which is another government program that it goes to senior citizens. That was passed in the 1960s. About 1%, a little over, get their health care through the military. That leaves about 15%, which are probably roughly evenly split now. About half of them, 7-8% of the population now, is probably uninsured. Maybe 6-7% buy health insurance on the open market themselves.
What is stopping American healthcare reform, that you're living in fear maybe if you don't have the right job or you don't have the right insurance?
That's such a great question. I think there are two things, and here's the biggest, which I think might be a surprise to Europeans and to Americans even, which is that Americans like their health care. And
they like their private health insurance. Okay, right.
They like what
I like
they
mine.
have.
I like my private health insurance. Yeah, who doesn't? Yeah.
The polling's pretty consistent. It's about 60% of people are happy with their health care. The flip side of that is the polling's also pretty consistent, that something like 15 to 20% of Americans think health care for everybody is in a good spot. It's kind of like that thing about politicians. They always poll people and they say, what do you think of politicians? Everyone's like, they suck. I can't stand those guys. And then you go, what do you think about your representative? Oh, yeah, she's great. Yeah, I like, it's the same thing. And the polling also shows how polarized we are here, because basically what happens every time a new president takes over, the sentiment towards healthcare in that party flips. So, when Biden's in office, you ask a Democrat how healthcare is, they go, it's pretty good. And then the day Trump takes over, oh, no, it's a disaster. We got to fix it.
I struggle when I talk to Americans and say that, there's political and constitutional issues around healthcare. In Ireland and in Europe, the basic idea is that if you get sick, it's a social problem to kind of be dealt with collectively, I know there might be 3 reports, 2 white papers, and an argument on the current affairs programme about it. It will get dealt with. So when you say between political factors and constitutional issues, that kind of leaves me very wary of the American system. I don't want to travel to America because of Trump anymore. I'm afraid to travel in case I get sick over there. So if I travel to France or Germany, okay, we have something called a general EU medical insurance card is what it is. So, and that enables you to get treated in any other country the same way you would as in Ireland in the event of emergency. And it's free. So it's just an insurance card. You put in your wallet. You have an accident in France or Germany or Italy, wherever you are. You hand over your card. It has your insurance number on it, and you're covered.
Right.
I struggle when I hear political factors around healthcare. I really struggle about that because we got 27 countries able to agree, right? If somebody gets sick and they're a different nationality, we look after you.
Right. That almost sounds like a line you hear from people on the American left about healthcare, which is that healthcare is a human right.
Yeah, it is.
As opposed, and back to your original point that it's a service. It is something that government should do. It is not something to be viewed as an industry.
I'm sure some people are listening here from the United States to say this is like European communist there, but I mean,
yeah, you're a pinko.
Yeah, I'm a pinko communist, socialist. A lot of people in America would see me a left-leaning communist because I think healthcare is a fundamental right, and I do. I firmly believe that. And if you speak to most people in Europe, they're going to absolutely agree 100% with you. Healthcare is absolutely human right, and the fact that if you're not insured in the United States, you have to rely on charity or whip arounds in pubs to get your oncology treatment or your cardiac treatment, whatever the case may be. That leaves me very cold.
I can see that. I can absolutely see that.
When you said that that company earlier had a market cap of 300 billion, your healthcare has been decided by an actuary somewhere. It's not being decided by medical professionals.
There are people on the American left who agree with you and who agree with you violently. United Healthcare, that company that I mentioned, their chief executive officer was murdered in the middle of Midtown Manhattan by somebody who targeted him, who set out, to send a message. And there were many people on the left who maybe didn't quite excuse the murder, but kind of said it was understandable because they saw that person as basically the avatar of a system that is cold, that is based on money and not life and things like that. The one point I would make, and I imagine to some European listeners, this sounds almost sociopathic, but those people are in the minority and they have always been in the minority. The people who say healthcare is a human right are people who have never been close to national power in this country since we started, having health insurance a century ago.
Is the healthcare lobby particularly strong in the United States? I'd imagine.
They are particularly strong. One of the things that's funny about them is how consistent the message has been. So after World War II was basically the first real effort in the United States to get universal health care. That was Harry Truman, who took over when FDR died.
Yeah.
And so in 1949, he decides that's what he's going to do. And there's this massive lobbying campaign led by the American Medical Association. They print cartoons of people waiting in long lines to go to the doctor because there's universal health care. And they call him a socialist and a communist, which in 1948, when the Cold War is starting, is a pretty effective and serious thing. And it is funny in a very, very dark way that when Barack Obama, exactly 60 years later, tried to push Obamacare, he was called a socialist and a communist. And people on the right said, oh, you're going to have these long lines and the quality's going to go down and all that thing. And yeah, it's lobbying. But to my earlier point, the lobbying works because people like what they have. People who have their stuff do not want to see it diluted or made lower quality, to help other people, to be honest with you.
Yeah, there's no such thing as the greater good there, isn't there? You say that people generally like their health care, but the statistics are saying Americans are paying 2.5 times on average more than all the other countries in the OECD. But the system is fairly fragmented, it's inefficient, and it's huge inequalities, massive amount of inequality there, but you're still paying 2.5 times more for your healthcare than everybody else in the OECD. So
that's true. But part of the issue is that when you say you're saying the collective us in terms of our share of GDP.
Yeah.
And I think that the fact that it's connected to your job, I think really affects how people look at it, because as you sit there and you go, it's just a fundamental human right. I imagine it's easier to have that belief when you're in a system that operates that way. We are in a system that operates for about half the country as if it's part of your compensation, as if it's something that you have earned through your labors. And I think that in and of itself, I might be stretching here. I'm psychoanalyzing, 130 million adults or whatever the number is on a very complex thing.
Yeah, we're here for the psychoanalysis of the United States mostly. I mean, Freud very, very famously said you can't psychoanalyze the Irish. So he's not wrong there. I've been to see a few of them over the years and they can't get to the bottom of what's going on with me. I'd like to know about Medicaid a little bit, right? So
Okay.
Trump cut a lot of that back there recently, didn't he? He cut programs, did he? He cut certain. I am.
Who are you asking? Are you asking a Democrat or a Republican if he cut them? They changed the requirements for some Medicaid programs, and again, everything about this.
What kind of programs would he be? Can you give me an example?
Well, these for Medicaid at the state level, which are programs that basically provide health insurance to low-income Americans.
Okay.
To our point about how complex it is, the definition of low income depends on what state you're in. So you may live in California and be eligible for Medicaid, and with the same salary or even a lower salary in Kentucky, you're not eligible. In the context of this broad debate, I think the Democrats' claim that the Republicans were slashing Medicare was a little bit of a political thing. And part of it, too, was reversing the changes that were put in during and after the pandemic by the Biden administration to expand Medicaid. If you got a Republican on here, and I think even a reasonable Republican, they would argue pretty fervently that, no, this wasn't about like cutting the program and kicking deserving people off. It was much more about the fact that the program had been expanded and it had gotten to the point where there was probably some abuse on the edges, or there were people on it who had other ways of getting care. But again, it's so hard to give a black and white answer to anything here because Emmanuel was right. It is just so bleeping complex.
I'm looking. Ireland is not some sort of healthcare utopia. I get the feeling my own personal experience is far from it, but getting into the system is quite tricky sometimes. Once you're in it, the system is generally quite good. And
what do you mean by that? Sort of once you start care for a certain.
So trying to get to see a consultant or a specialist, so you need to see a rheumatologist or a brain specialist in my case. Trying to get into the system, you could be waiting a little bit of a while, unless it's an emergency. If it's an emergency, you're going to be seen straight away. Okay, so, but I mean, if something lower down the scale and say rheumatology or something like that, you could be waiting 3 or 4 months to get into the system. Once you get into the system, it moves pretty quickly. You know, you are kind of well looked after. The only thing is, that it's a massive bureaucracy, an incredible bureaucracy, you know.
Yeah, thank God we don't have that in America.
Yeah, well, yes. Yeah, apparently not. Due to the hyper-capitalistic healthcare, you would think not. I mean...
Well, let's see. Again, United Healthcare has a market capitalization of $300 billion. United Healthcare also employs 400,000 people.
What? 400,000 people, one company?
It has 400,000 employees.
Oh,
that's one private insurance.
Is there many? Is that the biggest?
That's the biggest, but far from the only one.
Another thing that actually surprised me was surprised your life expectancy in America was so low. I thought it was just a case Trump's been in power, things are getting shit. No, it's not. It's none of that actually. In fact, gun violence.
Gun violence is a big factor. Yeah.
It's a big
car crashes are a big factor.
Yeah, we've car crashes in Ireland. Actually, we've had the worst year in 10 years for car crashes in Ireland. The US mortality rate for people between 15 and 49 is far higher than other OECD countries. Substance abuse, suicide, violence, gun violence in particular, and that's what brings down your mortality rates. It's actually not poor healthcare or bad doctors or a particularly dodgy nurse putting a microchip in your COVID vaccine.
Yeah, and more recently, it's fentanyl.
Yeah, fentanyl is a big thing. I've noticed that.
We did at the peak 100,000 deaths to fentanyl, which is just a staggering number, which is obviously more than enough to move those figures on its own. Yeah.
Where's the fentanyl coming from? Trump says it was from Mexico, but somebody said, I read somewhere else that it was coming from Canada. It's coming from everywhere but the United States, apparently.
The underlying ingredients are shipped from China. They're usually processed by cartels. As I understand it, Mexico is kind of the primary market for that. But if you have a pretty reasonable organized crime infrastructure, you can do it in most places. They're not doing it from Venezuela. That kind of got brought up every now and then ahead of that invasion, but it's not really a domestic thing. Crystal meth, which we had a fun little epidemic with last decade, kind of the first 15, 20 years of the century, that was a hot thing. That is domestic. We now have a thing where you can't get decongestant over the counter. You have to have the pharmacist take it out of the case because people were taking decongestant and turning it into crystal meth in these little bathtub facilities all over the
home care pharmacies. Yeah, there was an OxyContin problem there.
Yeah,
wasn't there?
yeah. OxyContin was a painkiller along the lines of morphine.
I was given that recently. It is fantastic.
Yeah.
But they only gave me one tablet and that was it. So
yeah, it was badly overprescribed with quite some help from a company called Purdue Pharma. I think there was some evidence when it first started that some doctors at least actually thought it was really a good thing. That managing pain is really something that medicine still does pretty poorly.
Yeah.
And they thought it was something that was a step change up, but it just turned into an absolute wildfire. There's a version of the story in which that started, and then at the same time, we invaded Afghanistan. We took out the Taliban. That took out the prohibition in Afghanistan on growing poppies, which then in turn led to a plunge in the global price of heroin, which meant that after people got hooked on OxyContin, or at least enjoyed OxyContin, they, and including some soldiers who came back from Iraq and Afghanistan, could then get really high-grade, super cheap heroin on the streets. And we wound up in the midst of a pretty ugly opioid epidemic 20 years now, and we're still trying desperately to fight our way out of it.
Ireland's system is not perfect, and it's a two-tier system, of course. You know, the coverage is broader when it comes to private health insurance, is where we get a lot of our private health insurance through our companies. Too, our mortality from preventable and treatable causes is about 20% below the EU average, I think thereabouts. I mean, we do pretty well. Our vaccination rates are quite high. I don't know, how are the vaccination rates in the United States at the moment, Vince?
Moving in the wrong direction.
Yeah, is that state by state or nationally? It's
both. Obviously, the effects are more pronounced in certain states based on political leanings and things like that.
Yeah, that's what I was getting at there. Is it in blue states? Is it better? In red states? Is it worse? Yeah, it is.
Yeah, if you want to put it that bluntly, yeah.
Poverty rates in Ireland are quite low now at the moment compared to Europe as well, so that helps our healthcare system also. And extreme deprivation are quite low, and social protection is somewhat stronger, and that all helps to keep our life expectancy up and above average. Again, it's not perfect. We've had our scandals with Children's Health Ireland. There was a scoliosis scandal,
Is this Justice for Harvey?
Yeah, Justice for Harvey, yes. Right. Children's Health Ireland's a hot mess at the moment. It's a function of the Health Service Executive that deals obviously with children, and it is a hot mess. And the Minister, Jennifer Carroll MacNeill, now has decided to break it up, disband it. It's not fit for purpose because it's been failing so many children. So, and I think if you go to any other of the 27 different countries, France very famously is, has one of the best healthcare systems in the world, but you will find people complain about that. So when I'm talking to French colleagues, they go, no, it's not perfect. They'll shrug their shoulders and go, same as other countries. You're going to find cracks. People are going to fall between the cracks. But it's like everywhere else. You're not going to find any health system in the world is perfect. None whatsoever.
Of course not. Yeah. In Ireland, even acknowledging that there are flaws, that there are things that need to be fixed, is the public as a whole generally satisfied with having a single payer model, with having the system the way that it is? Is there any political appetite for just a massive tear down, or is it mostly people want to see renovations, so to speak?
People would like reform in how quickly they're seeing that, but I think that's true for every country in Europe.
Of course. Yeah.
It's not unique to Ireland. We do have a lot of anecdotal evidence out there at the moment that it is taking longer to get seen. More and more waiting times are increased.
That's hugely true.
Yeah, waits and accident and emergency wards are going up. It is quite difficult to get into primary care sometimes to see your local GP. I think there's a 3-week wait at the moment to my local GP to get in and see him.
3 week?
Almost 3 weeks, yeah.
No, we're doing months here now.
Months?
Yeah.
So I was giving out the other day, and I was actually saying to her, 3 bloody weeks before I get to see a doctor. I mean, take me to the vet, I get seen quicker. It's you're telling me months to see a GP. You phone a GP tomorrow morning, and he'll tell you about 3 months before he can see you.
If you're just saying, I got this concern or something, it can easily be 3 months right now.
3 months.
And that assumes you can find. We also have a big problem in the sense that we don't really have GPs anymore.
No?
It is a dying specialty, particularly in rural areas. That idea of the country doctor is going the way of the shade tree mechanic, as we used to call them. Are you familiar with that phrase?
No, I've never heard it before.
Yeah, shade tree mechanic is what it sounds like. Guy who used to work on your car under a tree.
Right.
Yeah, the death of the GP, so to speak, has been a long running issue here. GP and OBGYNs, particularly in rural areas, is a big problem. But if you could tell Americans that under your system you get seen in 3 weeks, I think the Democrats would be very happy to put you in front of Congress.
And now with the GP care, that doesn't matter if you've private insurance or if you're on social welfare, or we have something in Ireland called a medical card. It's the same as your Medicaid, and just everything in your health services are free. Your pharmacy stuff is free. Everything is free. But when it comes to senior GP, there's no distinction being made between a private person and somebody that's on a medical card or health. Okay. So you just have to get in queue. You get in line with everybody else, private health insurance or otherwise. So, but 3 weeks, I was shocked at that 3 weeks. So,
I mean, you're talking 3 weeks for something that is not an emergency.
No.
Not something that will be resolved in 3 weeks, either because you died or because you got better, right?
Oh, I mean, if you're sick in America, essentially, you just have to go to an A&E ward, accident emergency ward, and
we have a massive network of these things called urgent care centers, which have kind of blown up in the last 2 decades. What we call nurse practitioners, which are nurses with an extra degree of study. They're kind of, between somewhere a nurse and a doctor. Yeah. I've known a couple in my life, and they will tell you, particularly after a couple beers, that they're smarter than the doctors anyways. And I'm not entirely sure that they're wrong, but I mean, we kind of have a network for that. But yeah, particularly since the pandemic, for reasons I don't 100% understand, and I'm not sure anyone else does, waiting times have really gone through the roof. I've had a couple appointments set up where I was stunned at how long. I'm calling in February, and they're like, okay, well, we're looking at November. And you're like, excuse me?
First world country. I mean, you might be seen quicker in Sudan by an Irish charity.
That's true. Yeah.
Again, I just get the sense that in the USA, the medical services are business opportunities for people who are providers. Your appendix is not an emergency. It's a revenue stream almost, that kind of way. And look, again, Ireland is not great either. I mean, we shovel a load of cash at the hospitals and consultants and layers of management and stuff like that, and we wonder why it takes so long to get seen. But I'm aghast at the thoughts of spending 3 months sitting around with a pain in my face waiting to see a doctor. It's like, I suppose in America, there seems to be shoving the money into marketing departments and actuaries and stuff like that.
I think there's a little bit of that, but I think at the end of the day, we just have our bureaucracy in the private companies instead of in the public company. I'm personally a little skeptical that there would be this massive change if we took what United Healthcare does and folded that into the federal government. One of the problems, in this discussion, and you say, people everywhere can complain. Whatever system you have, that system exists at least in part because healthcare has to be rationed. We don't have the ability to give the best care to everybody on demand, and the way that Europe and America respectively ration that care, it's not surprising given kind of the broader economic and social beliefs that those societies hold.
Vince, can I ask you about the horror stories of insulin that we are fed here in Ireland and Europe? Insulin is a couple of $100, $400 or $500. Are the stories true that insulin is so expensive for some people that they're just dying because of lack of access to it?
I think there are true stories of that happening, yeah, unfortunately. There's one study that I think it's like 16% of people who take insulin have rationed it at some point. That's a long running issue here about drug prices. It goes way beyond insulin. Even Trump has kind of gotten in on that. The idea that we pay $300 for a drug that costs $30 in Ireland or $22 in Sweden, things like that. Emmanuel, in that book that we cited, he notes that drug prices alone are the reason why our spending on healthcare as a percentage of GDP is so much higher. It's not the only reason, but they're a material reason. And that's been a debate for years. People drive across the border to Canada and go buy drugs there. Yep.
They're the famous stories there. If you're living in Detroit there, you're just over the border, everything's much cheaper. In Ireland, they're capped for your listeners. In the United States, you pay X amount, and if you go over that amount, you can claim it back in tax, or you'll be reimbursed from the government.
I see.
So
yeah,
it's
and
managed.
right. And that issue winds up with the same issue that we're talking about with health insurance. And people on the left go, oh, we need price controls or we need Medicare or Medicaid or both to be able to negotiate these lower prices. And the drug companies go, then we're going to make less money and we're going to develop less drugs. And it's the same thing in health insurance. If you give everybody health insurance, then the people who have health insurance now, the argument that they're told is, well, then you're going to have a longer time to see your doctor and you're going to get worse care.
Look, I the feeling I get here, the American system's kind of two-tier, but within those two tiers, there's other tiers. It's tiers within tiers. It's quite opaque. It's quite daunting. I mean, you just do not want to get sick in America, so travel insurance is a must if you go there. Absolutely, without doubt. It's not something you could risk coming from Europe to America and you don't have health insurance.
The financial aspect of it, I think, would be worrisome. But I think the average European would be so overwhelmed by the paperwork and the complexity and the questions and the amount of people that you would need to talk to and the amount of sign off you would need and everything else that they might just kind of give up and just say, whatever, I'm just walking out. I'll handle this on my own because I cannot sign another iPad box.
Vincent, can I give you a quick quiz on how much of the US federal budget is spent on healthcare? This is the budget now, not the GDP or anything else. What of a percentage of your total budget? How much?
I think of our budget, it's now like high 20s.
Yeah, it's about 27%. In communist Ireland, where we're all one size fits all model for healthcare, how much of our budget do you think is spent on healthcare?
I would think it's got to be higher, right?
No, it's the same. It's the exact same. It's 27%.
Wow, how about that? Yeah.
Right. So you have two massively different models in terms of outcomes, how you spend your money, how you get healthcare, how you get access to healthcare, your mortality rates, add them all in. And at the end of the day, both governments are spending the same amount of money. The federal budget, I think, where they're spending nearly $2 trillion. That's more than what you spend on your military, actually. You spend on healthcare.
It's close to double now. Healthcare spending in the federal budget. The one point I would make is the percentage of our spending that is outside the federal budget has to be exponentially higher than yours. Our states are spending way more than your counties or cities are spending. Our private sector is much larger than yours is. So
yeah, we've something known as local authorities here that are responsible for various budgets and spending and stuff like that. There's 4 or 5 of them, as opposed to 50 in the United States. So I mean, you have your 27% there of the total American federal budget. And then on top of that,
on the GDP level, I mean, we're like basically 4 percentage points clear of all other developed countries. Emmanuel's book, this was 2022. The U.S. is 16.5%. France was 12%. The world is 10%. So the gap, just to put that in context for American listeners, the gap between us and France right now is about $3,000 per person per year. This is not like, oh, it's a couple bucks. Like there's a reason healthcare just is a permanent political issue in America. And that's a big reason why.
Yeah. So like in Europe, we treat healthcare like a public utility, like roads or water or bad music at Christmas or whatever. I mean, government fights elections on waiting times and waiting to get seen. In healthcare in America is, it's you're wedged somewhere between the actuaries and people that actually want to help people. It's a very hard thing to balance in the United States when you've got competing interests all the time pushing against each other, where ultimately at the end of the day in Europe, the model is that, once the patient survives or has a good outcome, that's what matters, no matter what the cost, I suppose.
I mean, I think if you got somebody from United Healthcare on here, that they would say that actually, the point of their company is to work in that direction. That's the company, as we noted before, where the CEO was murdered. And the idea that he himself is responsible for the outcomes of his company is something that people who excused that murder and in some cases outright supported it, I think they would agree. I mean, I think that's nuts.
Can you be refused health insurance in America on spurious grounds? Like just, we don't look your genetic profile, we're not insuring you.
That's a big part of what Obamacare did. So one of the big aspects of Obamacare, which was popular then and remains popular now, is that Obamacare established that insurers could not deny you for a pre-existing condition, which from an insurer standpoint, makes sense, right? If they know that you have a long-running serious illness, they don't want to insure you for, $300 a month when the odds are that you're going to need $150,000 worth of, medical treatment a year. But from the patient's perspective is equally horrible, which is you're 33 years old, you get sick. Now, maybe it's something that you recover from. Maybe it's not a chronic illness for the rest of your life, but there are people in their 30s who now they can't get insurance at all, who now spend the rest of their life basically saying, if I have a recurrence of this thing, best case scenario, I'm bankrupt. That's literally the best case scenario. Right.
Europeans complain about our health care systems constantly.
Right.
It's a continental sport. Have you ever met an Irish person that doesn't like to complain? I'm sure you've met plenty.
No, I've heard a few complaints even in a very nice pub. Yeah.
Now you hear me complaining all the time. Our complaints are about how the state looks after us, not whether the state will look after us.
That's another phrasing that definitely jumps out in this conversation to me, but that's an interesting way to put it. We have an expectation of very, very basic care, but at the state level, it's basically the state mandating that private enterprises do certain things for you. As in, if you show up at the ER with a kitchen knife in your bicep, they can't tell you to go home. But there's not that underlying belief that the state is supposed to take care of you. But I think, some American listeners and many Americans who aren't listening would say that's precisely the point of America, that we don't believe that the state is supposed to take care of you. You're supposed to take care of yourself. It's the state's job to maybe step in when that fails. But I think a surprising number of Americans would say even that's not the state's responsibility. That's government-sponsored charity rather than the government fulfilling its natural role, so to speak.
Yeah, and I'm back again there to treating healthcare like a utility. I mean,
right.
By some logic in the United States, the federal government shouldn't be building roads or bridges.
There's some incoherence to it, certainly.
I'm trying my best not to insult all of our American listeners here at Tull and Vince, and I'm probably failing massively.
If it makes you feel better, I think more Americans than you think would probably agree with what you're saying. I can quote one of them. Gentleman who said, quote, "The goal should be clear. Our people are our greatest asset. We must take care of our own. We must have universal health care." Listeners may not be surprised that that's a quote from our current president, Donald Trump, from a book, The America We Deserve, a book on public policy that Trump published in 2000 when he was first seriously flirting with the idea of running for president.
I hear private enterprise a lot and, private health insurance and all the rest of it. If you lose your job in Europe, you get to keep your health care.
Right.
Okay. If you lose your job in America, you're probably going to have to switch on YouTube for a TED Talk on resilience or something like that, Well,
you go to ChatGPT. You say my fingers are tingling. We do have a government-required program called COBRA, which you can keep your health care, but you have to pay for it. But that I believe that lasts like 12 months. But yeah, when we were talking about bankruptcies before, this is something that, like Bernie Sanders would tell you when he's citing these numbers, is the bigger issue is you get sick, you lose your job because you're not showing up to work enough because you're sick.
And then,
you lose your health insurance. And that is always something that particularly for the left just catalyzes why this system just doesn't work. And I would hope most Americans are at least sympathetic to that. What happens when we're having discussions about major healthcare reform is that they believe, or they are told to believe, or they are convinced that fixing that problem is going to create a problem for themselves. And they believe that they're going to have to make a sacrifice themselves to do that. And people quite often are not willing to do that.
It's late state capitalism at its worst, really, isn't it?
That's certainly one way to put it. But that also explains why we've been having these arguments for almost 80 years now. It's a big reason why Donald Trump first promised a healthcare plan in 2015. He's never delivered one.
No.
Because it's really complicated and it's very difficult to find something that's going to thread the needle.
I will say this about America. It seems to be the only country in the world where an ambulance ride to hospital can be the one thing that will give you another heart attack and finish you off once you see the bill.
Yeah, you do hear those stories. People go to the ER, $300 to see the doctor, $5,600 to get there.
Oh, that's, just for an ambulance ride. Look, we hope we clarified some of the issues and the differences between the two healthcare systems, or we've probably muddied the waters a little bit more than we needed to, because the American healthcare system.
I apologize on behalf of America just for the fact that we cannot create a healthcare system to make an episode like this logical, common sense, clear, detailed, anything like that. But that's on us.
And it should be said, the Irish healthcare system is far from perfect. I'm winding Vincent up a lot about the American healthcare system, but no system is perfect. I'm Tull from the Irish Politics Newsletter.
And I'm Vince Martin from Wall Street, Maine. Please stay healthy.
Thank you for listening. Bye-bye.
Bye now.